Today we will study about arm bones. First one is humerus. The humerus is the long bone between the shoulder and the elbow. It has the ball of the ball and socket of the shoulder joint. At the other end, it has its portion of the elbow joint. The humerus serves as an attachment of many muscles and ligaments in the arm. Some of the attached muscles run all the way into the hand. The humerus typically become a problem only when it breaks. There are many types of humerus fractures, and as a result, the treatment for these fractures are quite variable. One is radius. The radius is one of the two forearm bones and is on the thumb side of the forearm near the hand, but is always on the outside of the elbow. The position of the radius changes depending on how the hand is turned because the radius twists around the other forearm bone, the ulna at the elbow. The radius is a part of the odd shape joint between the humerus and the two forearm bones. The joint between the radius and the humerus by itself is like a ball and socket joint, with the radius forming the socket. The radius has a many muscular attachment to move the elbow, forearm, wrist, and fingers. The end of the radius lead to the wrist joint. The radius and the ulna are joined by the cartilaginous joint at the elbow and at the wrist. They are also joined by the multiple ligaments. There are many ways that people injure the radius and the forearm. Breaking the bone is common because when we fall, the hand and the arms are typically used to break the falls. Ulna. The ulna is one of the two forearm bones and is on the smaller finger side of the forearm. Unlike the radius, these bones does not twist. So when the hand changes the position, the ulna is always in the same position on the inside part of the forearm. Like the radius, the ulna has joints at the elbow and wrist. The joint between the ulna and the humerus is a hinge joint type. At the wrist, the ulna has a smaller surface in contact with the wrist bone and typically bears less of the force from the hand and the wrist bone. The ulna is joined to the radius throughout the forearm with a cartilaginous joint at the elbow and wrist and multiple ligaments connecting to the radius through the whole length to the forearm like the radius. Breaking the ulna bone is a common reason for problems with the ulna. Wrist bones. First one is scaphoid. Is a bone in the wrist. It is a part of the first row of the wrist bone, but it helps to link the two rows of the wrist bones together. Its name derives from the Greek word for boat because it's thought that the scaphoid resembles a boat. Most of the scaphoid is covered with a cartilage which connects to five other bones in the wrist and forearm. The part of the scaphoid without cartilage is attached to a ligament and has blood vessels that come from the radial artery. Bones need blood flow to heal. A broken or fractured scaphoid can have difficulty healing or may never heal because of a disruption of blood flow through the scaphoid. An intact scaphoid is important and necessary for proper wrist function because of how it interacts with the other wrist bones. Second one is lunate. Lunate is a bone in the middle of the wrist in the first row of the wrist bone. Like most of the wrist bones, it is almost entirely covered in a cartilage. This bone has a secret shape which seen from the other side and its large cartilage surface allows from significant wrist motion. It is uncommon to break the luteolate, but the luteolate can be involved with the dislocation of the wrist and can rub against the ulna if the ulna is too long compared to the radius bone. Triquetrum is a bone on the small finger side of the wrist in the first row of the wrist bone. These bones add stability to the wrist, give the wrist a large surface to bear weight transmission from the hand and makes a joint with other carpal bones including the pisiform. Trapezoid is a roughly trapezoid-shaped bone in the second row of the wrist bone and primarily hold the index finger metacarpal bones in the place. This bone is uncommonly injured. Trapezium is a ladder-shaped bone in the second row of the wrist bone, and it is the main place where the thumb metacarpals connects the wrist. These bones have an odd shape that allows the thumb to move in a multiple directions, yet it stabilizes the thumb as well. These are the two main problems seen with the wrist bone. Breaking fractures, the bone is common, but the most common problem is arthritis between the trapezium and the bone it sits next to the wrist and thumb. Capitate is a large bone in the center of the second row of the wrist bone. It forms joint with the multiple bone in the wrist and hand. It sits primarily under the middle finger metacarpal bone. This bone makes an important contribution to the wrist motion. Mitet is a large, unusual shaped bone that has an almost triangular shape when seen from the top and is located in the second row of the wrist bone. And with the other wrist bones, it serves as attachment point for multiple ligaments and works with multiple other bones. It is one of the attachment point for the ligaments involved in carpal tunnel syndrome. It holds up the ring and the little finger metacarpal bones. The hemitate can be injured in more than one way frequently. The hemitate can break when people use the hand for punching. Also, the hook of the hemitate can fracture during a fall or if struck directly, such as when a baseball player swings a bat or golf swings a golf club. Pisiform is a small sesamoid bone, a bone within a tendon that sits in the wrist and in the flexion corpus ulnaris tendon. Like other sesamoid bones, it changes the direction of the pull of the tendon to which it is attached. Occasionally, the pisiform can break or can have arthritis in the joint it makes within the triquetrium. Hand and finger bones. Finger metacarpals. The metacarpals of the fingers make up the bone structure of the most of the hand. They are all similar in shape and have joint in the wrist on one end and the fingers at the other end. The index and the middle finger make finger metacarpals have a very little motion, while the metacarpals of the ring and the little finger move much more. There are three phalanges in each finger. The proximal phalanges is the largest of the three bones in each finger. The proximal phalanges have joint with the metacarpals and with the middle phalanges. Phalanges. The middle phalanges of the finger is the middle second or the third bone in each finger when counted from the hand to the tip of the finger. The middle phalanges has a joint with the proximal phalanges and with the distal phalanges of the finger. Distal phalanges. The distal phalanges of the finger is a distal or the third of the three bones in each finger when counting from the hand to the tip of the finger. The digital phalanges has a joint just with the middle phalanges. On the tip of the phalanges is a balloon tuft of the bone that helps give the finger its round appearance. The distal phalanges is also important for supporting the fingernail. Thumb metacarpal. The thumb metacarpal is similar in shape to the metacarpals of the fingers, but it is thicker. The thumb metacarpal has significantly more than the other metacarpals. It makes a joint with the trapezium that allows much of the thumb motion. This joint allows the thumb to move in a way that allows pinching. This is largely due to the unusual shape of the base of the metacarpals and the trapezium. The head of the metacarpal has a large joint surface next to the thumb proximal phalanges. Thumb sesamoids. The thumb sesamoids are the two small round bones at about the level of the thumb metacarpal phalanges joint. These comes at with the sesamoid bones lie within the tendons. The flexion tendon and the adduction pollicis attracts the thumb sesamoids Sesamoid bones help change the line of the pull of the tendons, which can help increase the force of tendon pull across the joint. The thumb proximal phalanges is a short and a short bone between the metacarpals and the distal phalanges. There in no middle phalanges in the thumb. Thumb digital phalanges. The thumb digital phalanges is a short bone with a rounded stuff at the end that makes a joint with the proximal phalanges. The balloon's stuff at the end of the bone gives the thumb its round end. These bones support the thumbnails. Elbow bones. Carotid process is a small projection of the bone of the ulnar bones that sits in the front of the elbow and on the inside of the elbow and on very near to the carotid process are attachment seats of the muscles and the ligaments of the elbows joint. The carotid process is important for adding stability to the elbow. Radial head is a somewhat rounded cup-like joints with the humerus and the ulna to make up a portion of the elbow joint. It has a cartilage surface for both the humerus and the ulna to allow bending and extending of the elbow and twisting of the forearm. It also can add a significant amount of stability to the elbow joint. It is a small, smooth projection on the surface of the radial bone near the elbow. It is attachment site for the biceps tendons in the forearm. Because of the position of the tuberosity on the radius, the biceps twist the hand, palm, and the forearm. Lateral epicondyle is a bone projection of the inside of the humerus bone. It is important primarily because its soft tissue attachment to the ligament and tendon. The ulna collaborate ligament and the common flex tendon attach here. The ulnar nerve runs immediately behind the medial epicondyle. Medial epicondyle is a bone projection of the inside of the humerus bone. It is important primarily because its soft tissue attachment to the ligaments and tendons. The ulna collaborate ligament and a common flexor tendon attach here. The ulna runs immediately behind the medial epicondyle. Olecranon. The olecranon is a large projection of a bone on the back of the elbow. It is a part of the ulna bone and make the point of the elbow.